Clinical quality improvement in healthcare, where we are and where we're going. It's no surprise to anyone that we are facing some major problems in healthcare in the U.S. Let's take a look at some of the major issues and at some possible approaches to solving them. We pay more per person than anyone else in the world for our healthcare. We have a fee-for-service pay system, meaning that providers get paid for providing lots of healthcare instead of for providing good healthcare. Half of our spending goes towards just 5% of the population. Healthcare can be dangerous. The Institute of Medicine estimates that somewhere between 44,000 and 98,000 patients die each year due to medical errors in hospitals. About a third of our annual spending is wasted on things that don't make Americans any healthier. That's around $765 billion spent on services that are unnecessary, redundant, or ineffective. Finally, millions upon millions of Americans do not have health coverage. So where do we start? How do we prioritize clinical quality improvement in healthcare? Here are a few ideas. Data management is going to play a huge role in turning things around. An enterprise data warehouse is one tool that organizes a health system's data into a single source of accurate and timely information. By and large, healthcare data is extremely convoluted. It's difficult to access, it's not uniformly coded, and it's not used to its full potential by medical personnel. A universal system to collect, manage, protect, and distribute patient information would improve patient health, steer the course of healthcare for the public, reduce wasteful practices, and significantly lower costs across the board. It's impossible for a healthcare organization to tackle every area that needs improvement at once. If we can identify the major problem areas, we can attack them effectively. For example, there is a tool that uses the 80-20 rule to find the 20% of care processes that consume 80% of an organization's resources. This approach is a win-win for providers and patients alike. There are other efforts going on that could have a major impact in our system. Meaningful Use is a governmental program that measures how effectively providers use electronic health records and provides financial incentive to do so. Accountable care organizations are exploring alternate payment methods, including payment per person instead of payment per service. These are just a handful of the ideas that are circulating in modern healthcare. Sooner or later, we'll all need a doctor, and we are all picking up the tab through our taxes. Do your part by learning all you can about the healthcare system. Check the links in the description for more information.